I'm Jade Parker. We understand that our government's new requirements to wear a homemade mask out into public spaces will be an adjustment for most of us. It's not something that we do every day. A homemade mask can help to prevent the spread of COVID-19 if worn correctly. Here are some tips to help make it easier. Masks should fit snugly but comfortably against the side of your face and be secured with ties or ear loops. You should be able to breathe through your mask, although you may find it a little hot because of your own warm breath. Keep the mask secured over your nose and mouth. Your nose should be fully covered. If it isn't, then your mask will not protect you. Avoid touching the front of the mask because this is where any contagious droplets may have landed. Instead, when taking the mask off and on or adjusting it, only touch the elasticated strings or the string around the top of your head. When removing the mask, put it on a clean surface that you will later disinfect. As an example, don't put the used mask on your kitchen counter while you wash and clean your groceries. For more tips and advice, please visit www.gov.ky/coronavirus.
Helping children cope during the pandemic is important. Remember to lead by example and take care of your own needs too. To support your child, listen and acknowledge their fears and questions. Provide clear information and be aware of your own reactions. Help children by creating new routines, limiting their exposure to media, and encouraging them to talk about what they've seen and heard. For free and confidential support, call the Mental Health Helpline at 1-800-534-6463.
We know you've been waiting to stop by. We know you've been hoping to have that birthday party. We know you've been wanting to hug your grandparents. And we know you've missed hanging out. Being kind and spending time with our loved ones is a part of who we are. But now we must rethink our social norms around leisure, around work, and around education. As we begin to reunite, remember we must continue to practice social distancing, proper hygiene measures, wearing your mask, shielding the vulnerable and elderly in our community. Remember, social distancing is came in kind. For the latest information, please visit www.explore.ky/coronavirus. We know in this community, family means everything. And there are different types of families in our community. So, who do you stay home for?
I stay home for my fans.
I stay home for my pageant sisters.
I stay home for my congregation.
I'm staying home for my students.
Aye, Captain West here stays home for all your land lovers out there.
I stay home to preserve my culture for future generations.
I stay home for my fellow athletes.
I stay home for the love of our masqueraders.
I stay home for the music fraternity.
I stay home for my community.
I stay home for my pupils.
And we all stay home because
Staying home is K-Mankind.
Staying at home is K-Mankind.
Staying home is K-Mankind.
Staying home is K-Mankind.
staying home is K-Mankind.
Hi everybody, this is Grace Byers, actor and author, and I just wanted to take a quick second just to say congratulations on everybody doing such a wonderful job, physical distancing, social distancing, and staying at home. And for a couple of people who might still be wondering why they should stay at home or if they should stay at home, I just wanted to share with you my personal reasons why I stay at home. I stay at home for the young, I stay at home for the old. I stay at home for my friends, I stay at home for my family. I stay at home for people who are healthy. I stay at home for people who have pre-existing conditions or who might have compromised immune systems. I stay at home for my coworkers. I stay at home for strangers. I stay at home for you. So thank you for all of you who are staying at home diligently, and thank you for the people who are on the front lines working for all of us every single day. So stay at home. Thank you.
Hi, I'm Jade Parker. We understand that our government's new requirements to wear a homemade mask out into public spaces will be an adjustment for most of us. It's not something that we do every day. A homemade mask can help to prevent the spread of COVID-19 if worn correctly. Here are some tips to help make it easier. Masks should fit snugly but comfortably against the side of your face and be secured with ties or ear loops. You should be able to breathe through your mask, although you may find it a little hot because of your own warm breath. Keep the mask secured over your nose and mouth. Your nose should be fully covered. If it isn't, then your mask will not protect you. Avoid touching the front of the mask because this is where any contagious droplets may have landed. Instead, when taking the mask off and on or adjusting it, only touch the elasticated strings or the string around the top of your head. When removing the mask, put it on a clean surface that you will later disinfect. As an example, don't put the used mask on your kitchen counter while you wash and clean your groceries. For more tips and advice, please visit www.gov.ky/coronavirus.
Helping children cope during the pandemic is important. Remember to lead by example and take care of your own needs too. To support your child, listen and acknowledge their fears and questions. Provide clear information and be aware of your own reactions. Help children by creating new routines, limiting their exposure to media, and encouraging them to talk about what they've seen and heard. For free and confidential support, call the Mental Health Helpline at 1-800-534-6463.
We know you've been waiting to stop by. We know you've been hoping to have that birthday party. We know you've been wanting to hug your grandparents. And we know you've missed hanging out. Being kind and spending time with our loved ones is a part of who we are. But now we must rethink our social norms around leisure, around work, and around education. As we begin to reunite, remember we must continue to practice social distancing, proper hygiene measures, wearing your mask, shielding the vulnerable and elderly in our community. Remember, social distancing is came in kind. For the latest information, please visit www.exploregov.ky/coronavirus. We know in this community, family means everything. And there are different types of families in our community. So, who do you stay home for?
I stay home for my fans.
I stay home for my pageant sisters.
I stay home for my congregation.
I'm staying home for my students.
Hi, Captain West here, stays home For all your land lovers out there.
I stay home to preserve my culture for future generations.
I stay home for my fellow athletes.
I stay home for the love of our masqueraders.
I stay home for the music fraternity.
I stay home for my community.
I stay home for my pupils.
And we all stay home because
Staying home is K-Mankind.
Staying at home is K-Mankind.
Staying home is K-Mankind.
Staying home is K-Mankind.
staying home is Caymankind.
Hi everybody, this is Grace Byers, actor and author, and I just wanted to take a quick second just to say congratulations on everybody doing such a wonderful job, physical distancing, social distancing, and staying at home. And for a couple of people who might still be wondering why they should stay at home or if they should stay at home, I just wanted to share with you my personal reasons why I stay at home. I stay at home for the young, I stay at home for the old. I stay at home for my friends, I stay at home for my family. I stay at home for people who are healthy. I stay at home for people who have pre-existing conditions or who might have compromised immune systems. I stay at home for my coworkers. I stay at home for strangers. I stay at home for you. So thank you for all of you who are staying at home diligently, and thank you for the people who are on the front lines working for all of us every single day. So stay at home. Thank you.
I'm Jade Parker. We understand that our government's new requirements to wear a homemade mask out into public spaces will be an adjustment for most of us. It's not something that we do every day. A homemade mask can help to prevent the spread of COVID-19 if worn correctly.
Good afternoon, everyone, and welcome to today's press briefing on the coronavirus. I'm Donna Bush. Glad you could join us via our channels as well as live on Radio Cayman. For today's prayer, we go to Reverend Elsa Bob.
I'm all within. I'm just a woman. Lord, help me believe in what I could do and all that I am. Show me the steering. I have to fly. Lord, for my sake, you teach me to do one day at a time. One day at a time, sweet Jesus. That's all I'm asking from you. You give me the strength to do every day what I have to do. Yesterday's gone, sweet Jesus, and tomorrow I hope will be mine. So help me today, Lord, show me the way, one day at a time. Our Father in heaven, please give wisdom to our governor, our premier, our health minister, all our leaders, and our health professionals. Please protect all of our residents and provide for them. We claim the eradication of this virus from our islands, O Lord. I now ask for your guidance in this press conference. In Jesus' name, amen.
And thank you, Reverend Bob. We'd now like to welcome our panelists, including His Excellency, the Governor, the Honourable Premier, and the Honourable Minister of Health. With us in studio today, we have the Chief Medical Officer, as well as Mr. Graham Jackson from Hazard Management, along with our sign language interpreter. Joining us via Zoom are members of the media, as well as Dr. Samuel Williams Rodriguez, the Medical Officer of Health from the HSA. We go first to Dr. Lee.
Good afternoon. A quick mention about face shields, as I've had a number of questions about these. Face shields are essentially an advanced form of protection for your face related to any droplet or sprays type spillage, and they don't substitute for a face mask. So please bear that in mind. The face mask protects your breathing through your mouth and your nose. The face and the face shield is more for your eyes and any other droplets that might arrive from your face, and is particularly used in the areas of the hospital where there is potential aerosol generation, like intensive care units and so on. For today, we have 694 test results to report, 4 of which are positive. One of these positives is a contact of a known positive case, and 3 have arisen through screening. They were asymptomatic and come up through our screening program. That brings our total tested to 13,947. Our total positives over the last few months is now 164, with 3 of those being in Cayman Brac. And if I dwell a little about the Cayman Brac figures, there you know they've also been undergoing an enhanced screening program and have now had 1,017 samples taken, which is 51% of the population. So far, of the results that have come back, we now know that 41% of the Cayman Brac population are negative for SARS-CoV-2. There are some 200-odd results still pending. Of those active cases, we have 1 that's symptomatic, 69 asymptomatic, and 93 recovered cases. There are 54 persons in our government facilities and 220 undergoing isolation at home. The 2 people who were in isolation in Her Majesty's Prison Fairbanks have now been released as they have had 2 negative tests. In the flu clinic, there were 11 seen in the previous day and 31 calls, although only 16 of those were related to flu itself or any symptoms that could be related to flu. Thank you, Donna.
Okay, thank you very much, Dr. Lee. We're going to go to Wendy from CNS for questions for Dr. Lee. Wendy, please go ahead.
Thank you, Donna. Good afternoon, Dr. Lee.
Good afternoon.
Just have a couple of questions for you with regards to sort of figures, just as a sort of out of public interest, really. Did we keep or have we kept a running total of how many people were symptomatic at any of the 160 odd that tested positive? How many of those were at any time symptomatic?
We have an access database where everybody is entered, and in particular those who are positive get a lot more details naturally entered about them. And that has the breakdown of exactly what symptoms everybody is presented with.
So do you have a figure of the 160 saying, for example, 100 were completely asymptomatic and 60 have been symptomatic, something like that? Do you have that breakdown? Do you know that number?
The breakdown's available. I don't have it here to hand, Wendy, but
okay, cool.
It's readily available. You need to bear in mind that it's not a fully accurate report, because the moment somebody is known to have something, they start to get intense scrutiny. They're called up daily by a nurse or a public health official, or contacted physically perhaps as well, and therefore they'll
right.
begin to report things more than they might normally do if they were just going
right.
about their normal lives. So you have to sort of bear that little bit of, it comes with a little bit of a rider.
Okay, yeah, I understand that. So another figure that I would be interested in getting, if it's possible, is whether any of the asymptomatic people have been over the age of 70 or have had underlying conditions that have previously seen people get sick, and whether you've kept that data.
Wendy, it might be helpful if you were to jot all of these questions down and develop, if you could list a lot of different questions. I know that Cayman Compass also has some questions in this regard, and it might be easier if they were presented in a written format to answer all of the different queries that you had, and it could be that some graphs might help as well. And
yes,
then you
definitely.
could share
I'm happy
those.
to do that.
Yeah, so if you could maybe please email them to me, I'd be happy to help.
That would be great. Thank you. That, I think, is all of my questions for Dr. Lee. Oh, no, just one more question. Given that the restaurants will be opening this Sunday, can we take it that servers and bartenders will also be part of the screening program now? The rest of the establishments that have been open and serving us all the while during the lockdown have been part of that screening program, and that's now been extended. And a lot of the restaurants which are going to be opening up to provide more services have already been screened. Yes, so they are part of the program. Okay, great. That's it. Thank you very much, Dr. Lee. Appreciate it. And we'll send the email forward to you this week.
Great. Thank you.
This weekend, even.
It can wait till Monday if you like.
Thank you very much, Dr. Lee. Thanks, Wendy. We're going to go now to our panel, beginning with the Honorable Premier.
Thank you, Donna. Happy Friday, everyone. Again, very encouraging results from Dr. Lee. Sometimes I think the results may be a bit too encouraging in the sense that the pressure to go further faster continues to build. And we're all obviously very, very happy about the way things are going. But there is just one sobering statistic I would ask everyone to bear in mind. Our positive infection or infection rate or positives is running somewhere between 1.3 and 1.5%. So if we believe the population to be about 65,000 people, that translates to 975 persons out there in the community who are likely to have active virus in their bodies. And I say that to underline the importance of maintaining proper hygiene, wearing masks, and the social or physical distancing. I know the issue of distancing at the bars and restaurants, the open-air bars and restaurants, which will be allowed to open as of Sunday, is causing some consternation and questioning, because it's not really usual or normal for people who are friendly and who go out to share a meal to be required to sit 6 feet apart. But the reasoning for that is that it is still a reality that there is significant amount of the virus out there in the broader community. And the only way we are going to avoid it continuing to be spread is to continue to be vigilant about social distancing and the wearing of masks and avoiding too many people getting too close to each other in social arrangements. So, as I've said just now, things are going very well, and this is largely because the public has understood and has cooperated with the measures, at least in large part, that the government has employed and followed the public health advice that we continue to receive. I would hazard to say now that Cayman is the most successful country in the world thus far with managing this pandemic. Obviously, we have some significant advantages in the size and scale of the country, and the population allow us to do things that other places find great difficulty in doing. But let us continue to do what we know is working and not get too far ahead of ourselves because we think that the virus is really not going to do us too badly if we get it, because a lot of people seem to be thinking that, or that it is unlikely that they're going to get it because the numbers of positive cases are still very small. But as I said, there are almost 1,000 people we can predict after 2.5 months or 3 months of testing. Now, we can predict that number is very accurate because the trend continues. No matter, once we get a certain number of tests done, we can look that's going to be what the positive rate is going to show. Moving on, I think everyone knows painfully that the lockdown has hit our tourism industry very hard, harder than anywhere else. And to date, more than 1,000 Caymanian tourism workers have applied to the government for assistance after losing their jobs. And government has now extended the deadline for unemployed Caymanian tourism-related employees to register for assistance with the Ministry of Tourism. They can continue to register until 11:59 p.m. on Sunday, the 7th of June. That's Sunday coming, because the deadline had previously been 31st of May. The proposal is for them to receive $1,000 a month for the next 3 months to assist them in getting through this epidemic and the challenges that they all face. Those who want to register can complete an online application at www.tourismregistration.ourcayman.ky, www.tourismregistration.ourcayman.ky. We began this week on Monday by reopening more sectors of our economy. The remainder of the construction industry, all retail and realtors have been able to open from last Monday, 1st June. And from the accounts I've received this week, all has gone extraordinarily well. Everyone, as far as we've been aware, are abiding by the social distancing requirements, the wearing of masks in public places, and the enhanced hygiene measures. So from Sunday the 7th, this coming Sunday, we are moving forward with further relaxation of restrictions with other segments of the economy to reopen. The hard curfew on Grand Cayman and Cayman Brac will move to 10 p.m. through 4:30 a.m. as of Sunday. As you know, this does not apply to Little Cayman, which has no restrictions. However, social distancing and the wearing of masks in public places continue to apply to all three of our islands. Persons will now be able to have gatherings of up to 6 people. In Cayman Brac, there are no changes, and gatherings of 25 persons or less continue. From Sunday, you will also be able to exercise with 5 other persons who are not members of your household for up to 2 hours per day from 4:45 a.m. until 9 p.m. You'll be able to exercise on the beach, swim in the sea, and fish from the shoreline on any day, including Sundays. In Grand Cayman and Cayman Brac, you'll be able to go fishing with up to 6 people in a boat from Sunday. However, you cannot travel for pleasure between the islands. You're also prohibited to congregate or visit Starfish Point, Rum Point, the Sandbar, or Stingray City. Also this weekend on Sunday, we will see the reopening of restaurants and bars that can open to provide an open-aired, seated service for food and beverages. The competent authority, with guidance from the Chief Medical Officer, along with other government departments, have developed guidance for restaurant and bar owners seeking to open for service from Sunday, the 7th of June. The guidelines are available at www.exploregov.ky/curfew time, the page developed by the competent authority to facilitate applications for businesses for exemptions and curfew restrictions. The rules set out for operations of restaurants and bars outdoors are as follows. Tables should be a minimum of 8 feet apart. The maximum group size is 6. Customers from different households must sit 6 feet apart. Customers from the same household can sit closer together. Social distancing must be maintained in restrooms and waiting areas. All seating from the bar areas, that is around the bar counter, are to be removed. No persons are allowed to be seated or served at an indoor counter in a restaurant or a bar. Specific to restaurants, all dining must be in an open-air establishment, no enclosed or AC dining allowed. All employees must wear masks and face coverings. Sanitization stations must be set up. Mingling or physical contact with others is prohibited. All employees must maintain social distances of 6 feet from co-workers and guests, except, of course, when they're serving them. That's impossible to do that. One-time paper menus will be used or no contact menu display boards. Shared condiments are not allowed on tables. All condiments must be single use. The bus staff must wear gloves and masks when handling used dishes and tables. Restaurants and bars shall operate until no later than 9 p.m. Customers can only be served when seated at a table. No bar or standing service is permitted. No bar counter or standing service is permitted. Customers must use a mask or face covering at all times when not seated at their table. Mingling within 6 feet or physical contact with others is prohibited. So that, I believe, is a roundup of where we are and where we expect to be come Sunday the 7th.
Thank you very much, Honourable Premier, Your Excellency.
Yes, thank you, Donna. Yes, good afternoon, everybody. And again, I share what the Premier has just said. I think the results continue to be very encouraging, and we are in a very good place. And Sunday is indeed a significant milestone in terms of further opening up our economy. I would just simply repeat again, it is so important that we keep going with social distancing, basic hygiene and wearing masks in public places. We really can't let our guard down. And if we continue to do that, we're in a really good place for, I believe, further significant relaxations when we get to the next point on 21 June, if the results continue to go as they are at the present time. I have a few other announcements to make today. First of all, I'm really pleased to announce the recruitment campaign for 50 part-time reservists for the Cayman Islands Defence Regiment starts today. Recruitment is open to British Overseas Territory citizens, British citizens, Irish citizens and Commonwealth citizens who are permanently resident in the Cayman Islands. If you are interested in this great opportunity and have a real sense of adventure, please do apply. You need to be aged 18 to 50 years. You will need to pass written and fitness tests and then an interview. Experience is not required, but previous service in the Cayman Islands Cadet Corps or similar military organisation is really welcomed. And full training will be provided, and successful candidates will be paid a per diem allowance when they attend. And of course, I think this is a great achievement to be moving forward with this during a very serious pandemic, and managing the COVID risk in how we move forward with this is obviously extremely important. So for more information and application and medical forms, visit www.gov.ky/CI regiment. I also just want to highlight that next week, as I've indicated before, we have the Royal Navy ships HMS Medway and RFA Argus here for the next 2 weeks. They will be exercising their plans to support Cayman should a hurricane or a similar natural disaster occur. And they're also providing helicopter cover whilst our RCIPS helicopters are off island for their routine maintenance. Now, the exercise next week will include bringing troops and equipment ashore, particularly onto a beach, to test logistics and then checking to assure that communications work and that they could carry out medical evacuations. The exercise this year will also ensure that appropriate measures are in place to avoid any contact between the ship's company, their personnel and people on shore. Both ships are COVID-19 free, and the crews have been at sea and isolated for an extended period of time. But out of an abundance of caution and also to prevent possible infection being transmitted to the ships, there will be no close contact with any people on our islands. Finally, just a quick word on evacuation flights. So next Friday's BA flight to London, as I've said previously, is full, but there are still a few seats left. So if you do want to fly on that plane, you can book at www.otairbridge.com. The inbound flight is also busy. There will be just less than 100 people coming back to Cayman, but the flight is going first to the Turks and Caicos, where it will disembark a number of passengers who are then going to Turks and Caicos, the British Virgin Islands and the Bahamas. So again, it's really pleasing that Cayman is playing a regional role and helping our neighbours in helping some of their nationals get back to their territories. As I've said before, my office continues the negotiations with the Indian government over repatriation of Indian nationals, and we hope to have some news on that soon. And then I just want to flag that there are two private individuals organising flights. The first one is Ecuador and Mexico, and this will go to Cancun on Monday, the 8th of June. Daniel Rodriguez is organising this flight, and we'll put his details on social media immediately after this. There's also another flight to Canada organised by the same lady, Nicole Poirier, who did the first one. That will be going to Toronto on the 13th of July. So again, if you want to go on those flights, get in touch with the individuals via our social media pages. Thank you.
Thank you, Your Excellency. Minister of Health.
Thank you, Donna. Good afternoon, everyone. Grand Cayman, Cayman Brac, and Little Cayman, and our Caymanian diaspora listening. I thank you for being a part of the solution. Should I ask, or does health really come from nutritious foods, vitamins, exercise, and medicines alone? I'd say no, it comes from peace of mind, peace in the heart, peace in the soul. It is magnified by laughter, love, and faith from God. Today's scripture is 1 Corinthians 13, 4, 7. I ended with love, and I would like to continue with that. Love is patient. Love is kind. It does not envy. It does not boast. It is not proud. It does not dishonor others. It is not self-seeking. It is not easily angered. It keeps no records of wrongs. Love does not delight in evil, but rejoices with the truth. It always protects, always trusts, always hopes, always preserves. May the Lord add a blessing to the reading of this holy word. Today's shout-outs goes to the Cayman Islands United Church Organization, Reverend Dr. Yvette Bloomfield and Reverend Forrester, that penned that letter to me, and I'm sure more are deserving of the same, of my contribution on the front line during the height of COVID-19. I thank you all for recognizing me. I want to say happy birthday to Shadden McLaughlin and Charlene Grant. May God continue to bless you, and may you find peace and good health, not only today, but for a lifetime. I have a few positive updates from my minister that I would like to share with you all today. However, before I dive into those, I would like to note some medical practitioner notes. These guidelines should be followed. Patients should be scheduled at intervals so that no two patients are in the office at the same time. Persons accompanying them are not to be allowed into the facility unless absolutely necessary. All routine, non-urgent or non-emergent appointments should be rescheduled until a later date. Administrative staff should not be in the facility unless there is a definable and clear necessity. Appropriate personnel protective equipment should be used when patients are being seen at healthcare facilities. PPE may be obtained from several of the local medical supply distributors. These measures are required to assist with the national requirement of social distancing. We know you are all working hard to safeguard our communities, and we appreciate your continued patience and cooperation. Moving on, I'm proud to announce that the launch of the Kids Helpline. We've been doing so much work to ensure we keep our children safe, healthy, and happy during these strange times. For so many children all over the world, the pandemic has caused so many hardships. The Kids Helpline is a free number to call for anyone across all 3 islands aged under 18 years old. The service is open Monday through Friday from 10 a.m. to 6 p.m. There is some discussions in trying to broaden the scope and to increase the hours of this service. It is a private, non-judgmental service which will safeguard and protect the rights of children and young people. They can call for any reason such as bullying, relationships, family problems, suicidal thoughts, loneliness, or anything else that is concerning to them. Parents who are concerned about their children are also welcome to call. I am also happy to report that so far children have been calling in, and it is already proven to be a wonderful, much needed resource for them. The number is 345-649-KIDS or 345-649-5437. I encourage the public to take advantage of this free resource. Today is also World Environment Day. Along with Earth Day, it is well known as a reminder for its efforts to encourage effective environmental action. Celebrated annual on June 5th since its inception in 1974, World Environment Day has engaged stakeholders and influencers to focus efforts on important environmental issues and offers a global forum for inspiring positive change, as well as encouraging governments and individuals to contemplate more environmentally friendly actions. The 2020 theme is biodiversity, and as the organization writes, it is a concern that is both urgent and existential. So much has happened in the past year, including massive wildfires in Australia, Brazil, and the United States, locust infestations across East Africa. As we sit here, we continue to address a global health crisis. A U.S. study has also shown that air pollution is linked significantly higher death rates in people with COVID-19, according to their analysis. In fact, many of today's environmental challenges are responsible for adversely affecting the health and livelihood of individuals and communities with the most vulnerable groups, such as the elderly and those of low socioeconomic status, taking the brunt of those destructive behaviors. Locally, we have our own environmental challenges, but I am proud to confirm that although somewhat overshadowed by the demands of COVID-19 pandemic, currently, our government remains committed to addressing such important issues as plastics and littering and providing long-term sustainable waste solutions to these areas. A further update in this regard will be shared soon. We are still dealing with the problem of people littering and illegal dumping waste materials in areas of our community. Sadly, this includes masks, gloves, and other types of PPE. Please do not put our community and our DH staff at risk with this type of irresponsible behavior. I implore to you to remember these are brothers and sisters out there hard at work. Keeping our islands clean and safe is something that needs the continuous private and public collaboration. This cannot and must not become a problem we continue to face as we move forward. I would like to remind the public of the litter law, and anyone who is found guilty of breaching the law could face jail time or $500 fine. DH has also asked me to remind the public that the landfill is open for drop-off. Please take note on the specific day to do your drop-off, as staff will check at the entry point of the alphabetical last name check. For individuals and for essential business collections, the Grab truck can be booked through DH, so there should be no excuses for not keeping our beloved islands pristine, clean, and healthy. The new COVID-19 landfill entry rules went into effect in early May. More details on this can be found on our website of www.explore.gov.ky/coronavirus. With that being said, I'm also proud to tell you that the Department of Environmental Health officers and D8 solid waste teams are working closely with the RCIP community support officers to alleviate littering problems across the islands. Today, in honor of World Environmental Day, DH has conducted a waste collection operation in the Whispering Waters along Hearst Road in Savannah. I would like to thank the DH teams for their continued efforts for all their amazing work, led by Director Sims. I offer a shout out to the RCIP at the Bordentown Community Safe, the Officer Unit, and Officer Shamarish Solomon, who organized lunch and drinking water for the DH workers for today's cleanup. I applaud them. Shout outs also to the Plastic Free Cayman and the Deputy Governor, led Wellness Initiative for their own environmental initiatives during this time. The Civil Service Wellness Committee is encouraging all civil servants to incorporate some roadside cleanup into their exercise time. Meanwhile, adhering to social distancing rules, of course, with each one doing their part, we can all help in keeping our communities cleaner. In closing, as we all witness the rejuvenation of environments around the globe during the pandemic, it has also prompted the world to amplify current or create new practices to protect the environment. We should also ask ourselves, what part did I play in making our environment better? What can we do to continue to keep nature in a constant space of regrowth? How can we as a country and part of the global community learn from this current situation? And what can we do as a community to move forward positively? Locally, it is my aim to continue to work towards the creation of the lasting legislation that will positively affect our environment by safeguarding green spaces, collaborating with environmental organizations, activists and educators, and to offer employment in these new technologies in hopes of raising up our new generation of gatekeepers. I thank you, and God bless.
Thank you very much, Minister Seymour. We're going to go back now to Dr. John Lee.
I just thought it would be worth providing a bit more information about some of the children. I know there have been a few requests. I mentioned the other day there have been 7 children that have tested positive for COVID-19 disease, but only 3 of those have been symptomatic, and the age range of those have been from 9 to 17 years old, so a little bit of a spread. Additionally, some more information about the disease itself. The incubation period we have known the whole while throughout this process is around 14 days, and that most people will present with symptoms within 14 days of a contact. That shouldn't be confused with how long you might be infectious after you have the disease. And that is somewhere in the range of between 8 and 20 days. More and more results from studies are coming in to inform this information. There's also something you've heard me talk about before about the viral counts and the viral loads, and we make an estimation of the viral loads based on the results from the PCR test. And although some reports are now showing that people are not infectious, and when we say not infectious, it means that the scientists can no longer grow viral copies from the samples that are taken from that individual. Although some people may not be infectious when their count is relatively high, there are also some people who you can still grow virus on when their count is very, very low indeed. So some of the people, to many of the people that we have picked up over the last 4 weeks or so, even though their count is quite low, at that same count, it has been demonstrated you can still grow viruses from them. So we're learning more all the time. A lot of this information will become more solid as we add to the studies. There will undoubtedly be country variations, possibly from different strains of the virus, and it'll be interesting to find out more as time goes along. Thank you, Donna.
Thank you very much, Dr. Lee. We're going to open up for questions now, and actually I'm going to ask the first series of questions today, and the first one is for you, Dr. Lee. Can persons, let's say from any industry that's been opened up so far, can they refuse to actually have the test done? For instance, if it's a construction worker and their company says you have to do the test.
We've sort of touched on this point before, and I'm not an expert in employment law. Certainly there are some industries, such as healthcare, where you can mandate that people are required to have a test because it's such a risk for you to be there. However, I would imagine that something like construction, it would be much more difficult to demonstrate that that was an essential business need. And a healthcare worker is never going to forcibly take a test from anybody. So.
Okay. Thank you very much, Dr. Lee. The other questions that I have are for the panel directly. Are we aware of any numbers of Caymanians that may be overseas that want to come home? Do we have a list?
I think the governor has more information than I do, but yeah, they're believe it or not, hundreds.
Yeah, I think the information that's come into the travel hotline suggests there are 600 to 700 people who still want to come back. So yeah, it is a large number.
Okay. As it relates to bus wardens, we know the school's been out. Bus companies have the bus wardens. Many of them are concerned about being paid. Do we have any update on where those payments may be or how that's going?
As far as I know, those issues have been resolved. But I'm sure my team is listening to me. If someone will send me information, I don't want to say something that is not absolutely the case. But I know that the technical issues have been resolved. I just don't know for certain whether or not the bus transporters, the contractors, have actually been paid yet. So if one of my team is listening, if you could send me that information so I can let the public know that before the press conference closes.
Okay. Another question. We've heard a number of businesses are now in the process of actually wanting to construct outdoor areas since they're now allowed to dine and I guess serve alcohol on the outside. Do they have to go through the planning process? Do they now have to change maybe even business licenses to be able to do that before they start the work?
No. The competent authority is requiring that they submit a plan of how the layout is going to be. Okay. But for a number of places, I know they're just proposing to put up tents, open-sided tents, so that they can set people apart. But many of these places already have outdoor facilities, and it's just a matter of reconfiguring it to meet the 8-foot distance between tables and to ensure that safety is observed.
Okay. Final question. Your Excellency, you may be able to answer this one. Are we aware whether Canada is accepting non-Canadians?
No, I can't answer that. We'll have to get back to you afterwards.
Okay. Okay, that's it for me for questions. We're going to go first to Kayla from the media from the Compass. Kayla, please go ahead.
Hi, I'd like to start off my questions today about some concerns being raised by parents. They're becoming quite anxious for updates about education. Do we know if the Ministry of Education plans to provide an update soon?
Anxious in what respect? Schools are closed until the start of the next school year.
Yeah, and so things that people want to know about is, will summer camps be allowed? How will social distancing be implemented for CXC exams? Will kids go on to the next grade level as expected in the fall?
Well, again, the issue of summer camps will depend upon the results of the exercise, which is currently underway, and the determination by the Chief Medical Officer as to whether or not it is safe to have those events. I suspect he's going to say no.
Okay. And with permissions for small groups up to 6 to meet up soon, is it possible to organize groups of children to meet up and play together? Is there some kind of outlet that we can offer our young people?
I think the answer to that, again, would be no, for the reasons we have recited over and over again. It is very, very difficult, although it's possible, to teach kids or to get kids to comply with social distancing requirements. What I would, again, urge, as I've done now for 3 months, is patience. In another 2 or 3 weeks, if things keep going as well as they are, we may well be able to relax further the numbers of people who we assess can safely gather together, and to allow limited interaction of groups of children in relatively small numbers. Because the thing with kids is that kids are going to play, they're going to touch, then they're going to go home to their families. And if they have contracted the virus, kids are generally asymptomatic. In fact, most people in Cayman now are that way. They're going to pass it on to their parents, who then interact with other people. And that's why, this this seemingly harsh restriction with respect to children is, believe it or not, so crucially important. Children are the single greatest vector of the disease, simply because of the way they tend to behave normally, and because they are generally asymptomatic. They probably don't even know they have it in most instances.
And there was recently an education discussion that was planned for Radio Cayman. I believe that was canceled, and we've gotten a lot of questions about if there's any plans to reschedule that, or if there'll be a different format in which parents can have their questions addressed, or to speak to the Ministry of Education.
Dr. Lee is going to try to help.
Sorry, Kate, I don't have an answer immediately to that question. I would like to announce that we're planning to do a mental health symposium similar to the clinical symposium that we had maybe 3 or 4 weeks ago. And that mental health symposium is going to have children experts on the panel, and we'll have a focus on children. And that is very likely to happen next week. I also wanted to mention at the same time that if children will be able to play with each other again, that will come, it will happen. But certainly, especially until we have the safety of a vaccine, I think it would be really sensible for families to think about realms and spheres within which they socialize to try to limit the risk, so that if there were to be an outbreak, firstly, you'll be able to know how better to contain it, but also it could be that your circle is not the circle that's affected, to protect each other. So to try and I know a lot of different countries are thinking about that, to try to reduce the risk by limiting it to certain circles that you always mix with.
Great, thank you for that, Dr. Lee. I know parents will appreciate the mental health focus of that panel. That's been a common issue that's been brought up to us. I also wanted to get some clarification from the Minister of Health about the announcements that were made today about scheduling patients. Is that, does that mean that medical offices will be reopening?
Dr. Lee is going to address that for you, Kayla.
Okay.
I think many medical services are currently open. They're certainly able to see urgent or patients with time-sensitive problems or symptoms that need addressing now. That's at their discretion. We've talked previously about this, but it's very likely that routine medical services would open at level 2. That's something that the Health Practice Commission will speak to, but it seems that is a sensible way to go. At the same time, the hospitals are likely to be resuming routine services there, bearing in mind that there may be a necessity for them to immediately switch into a more emergency way of working. But I know that they're building that scenario into their plans, or sorry, they have built it into their plans.
Okay, you said phase 2?
Level 2, beg your pardon.
And we had a parent reach out that they haven't been able to access vaccinations on schedule. Is there any update there on catching up with children's vaccinations?
Kayla, I can get Dr. Samuel Williams Rodriguez to address that for you. He is joining us via Zoom. Dr. Sam?
Hi, good afternoon. So yes, we have been providing some vaccination to children, especially the 6 weeks postnatal. The vaccines are due that day, but we are in the process now of organizing some vaccine campaign to catch up with all the ones that are behind. So the public health nurses will be contacting the parents and advise them of that. And we're gonna do some vaccine clinics on Saturdays and other days in order to catch up with all the vaccination for the children in the Cayman Islands.
Okay, thank you, Doctor. And I wanted to get some clarification about exercise groups and where they can meet. Can an exercise group of 5 meet at the beach regardless of the A to Z last names of the people participating?
Yes, there's no A to, as of Sunday, there will be no more A to Z with the use of the beach. So exercise folk can, 5 persons plus 1 out from different households can meet and exercise, just no inside the gym sort of thing, so it's open air that is being encouraged. And again, people are encouraged to keep the same circle rather than swapping in and out, because you just continue to increase the risk. We're getting to a stage with the management of this epidemic where more and more reliance is going to have to be placed on people's good sense and judgment, because as we lift restrictions, we can no longer control in the way we were doing in the past what people do or don't do. But people need to realize and recognize, as I keep emphasizing, that the virus is still out there. And the more people you mix with, the greater your chance of picking it up.
Thank you. Those are all of my questions for today.
Okay, thank you, Kayla. We go now to Ralph at Caymanian Time.
Good afternoon, members of the panel. It's Premier, the first question is for you, and following on from Kayla's last question regarding the alphabet system, could you just remind us what are the industries that this covers? Okay,
and let me try to explain the rationale so that people don't think we're just being arbitrary and control freakish.
Never.
It is to try to reduce the number of people who can potentially be in an establishment at any given time. That's why we introduced it in the first place. And it still holds for the supermarkets and for banks and stores and that sort of thing. It no longer applies to hanging out at the beach. And it won't apply to the bars and restaurants.
Do you know when insurance companies and employment agency and accounting firms will be open?
Well, they sort of fall into the broader financial services administrative group, which are not yet released. We'll, over the course of the next week and so, we'll start thinking about what the next stage or phase of the reopening should look like. Again, informed always by the results of the tests and the results of which of course give us an indication as to how the last release has impacted the infection rate. So far, it hasn't made any difference at all. The infection rate is still holding pretty much as it has for the last 2.5 months.
Okay, thank you. Just my last question for you, and then I'll move on to the Minister of Health. Regarding work permits and the employment situation, is it possible to have one of the directors or acting directors come on so we can ask some questions? We're concerned about a lot of issues regarding work permit applications, grants, and so on. And particularly now when, after this crisis has passed, we know employment will be the #1 item that needs to be addressed. And so I think there needs to be some clarity and some explanations and answers given to employers. And we are hearing quite a bit of these questions coming forward. And the question to you is, will we be able to get someone from that agency to come on so we can get some answers?
Well, as the minister responsible for border control and immigration issues, it would certainly help me if you could sort of outline in broad terms what areas of concern are being brought to your attention. Some are being brought to mind, and we're taking action with respect to them, but it will help because Cabinet's going to meet on Tuesday to make some significant adjustments, amendments to immigration regs on a temporary basis to address some of the concerns. But what are you hearing that you think you need answers to?
It focuses mainly on the renewal of work permits and applications. The deadline has just recently passed, and a number of employers weren't able to get applications in. They want to know whether they're going to have a chance to have the deadline extended, and how would they treat those employees who may not been able to have worked for the last 3 months, but have already used up their work permits. Those kind of questions.
Okay, well, Well, certainly those groups that you just mentioned, we have squarely in our sights, and we will address those on Tuesday. But I take the point more broadly. I'll see who I can get who knows more about this than I do in the detail to come on, as we've done with respect to pensions and some of the other things. Okay? Okay.
Thank you very much. My last question, Donna, is for the Minister of Education. I haven't asked a few questions in a while.
Okay, that would be health. Would that be Minister of Health?
Minister of Health, Mr. Seymour. This crisis has highlighted the need for health care practitioners in the Cayman Islands. Do you know of any programs that will encourage Caymanians to sort of follow that path of profession? As you know, that we always have a job in the healthcare industry. And so we know that not many Caymanians are in that industry. And so I think that is what should be encouraged is for Caymanians to sort of consider, diversifying and going to the healthcare industry. They don't know of any programs that exist today.
Well, very good question. Ralph. And it's been a pet peeve of mine for many years now. And I look at neighboring countries. I mean, we don't have to reinvent the wheel with everything. I look at neighboring countries like Cuba and other countries where they concentrated on certain specialities to encourage their people to be trained in, like doctors and nurses. And we see now Cuba has a lot of doctors and nurses and medical staff. And I think at some point the conversation has to be had in a very near future about where we want to take Cayman and what industries we want to get our people trained up in and where we want to put most of our resources. But I think we need to concentrate. I think we're all over the place as a country, my personal note. And I think we have the nursing program, which we started. That's very encouraging. That's at the University College of the Cayman Islands. That's very healthy and going. And there's some other opportunities that I've discovered over the last 6 months that wasn't able to be unveiled because of COVID-19 in terms of some opportunities in the United States for young Caymanian doctors and so forth that I've been working on for almost a year with another doctor who had some interesting contacts that would allow this to happen. And not only the University of West Indies in Jamaica, but very good conversation for us to continue having, and one that I'm duly interested in. And I think the government has alluded that their interest in the medical field in terms of training up Caymanians. So we just need to get a real solid approach as to how we move in that direction and where we want to go as a country. I've never really seen that drive like we had in the 80s of, it was financial services, or in the 70s, late 70s, financial services, and everybody was concentrating on that. And I do think we need to start thinking about that. But first of all, we need to ask the children, are you interested? Because sometimes I think we forget to include the children as to what they want to do and what they're interested in. Maybe it's just technology that we concentrate on, and a lot of that is happening here now with Tech City and everything else. So, great conversation for us to continue having.
I appreciate the response, and I would add that it's a very lucrative profession. And I think that once the children understand that, then it's a way to achieve their goals. With compensation that is, they will be very interested. And if I was to pass on come back again, I want to be a doctor, then I'll do very well. Thank you very much for your.
I'll ask Premier about that.
All right, thank you, Ralph. We go now to CNS. Wendy, please go ahead.
Thank you, Donna. Question first of all for the Premier. Can I echo Ralph's request there for somebody to come from work, because we have the same thing. There's a lot of questions coming up. In the interim, One that's come up from quite a few people now is regarding the Caymanian status applications that were made before the lockdown that people are still waiting on. And they have concerns that the boards still don't seem to be meeting. I think we discussed this at one of the previous briefings, but there's still no sign that the Caymanian status board is meeting. And there are now concerns that people may not make because if they get granted Caymanian status, they would have been entitled to register for the forthcoming election. And I think people are getting a bit worried that they might miss that boat because their case just never gets heard in time. Can you shed any light on that?
Well, I think fears about missing the deadline for registering for the election are a bit exaggerated. I mean, the elections are still just under a year away. There are multiple opportunities between now and then to register. We are getting the boards back up and going. I hear your concerns about the Cayman status applications, but from our end, we have millions of dollars outstanding with respect to PR fees that haven't been paid, some of them going back years. So we're having to process and deal with all of those as well. If you haven't paid your PR fees, your Caymanian status application won't get processed.
Okay, thank you for that. The next question is church. Is there any plans to allow small congregations, at least, from the 21st of June?
Well, again, those are things that are being discussed, and again, will be guided by what results are and the benefit of the public health advice at the time. But we would hope that the number could get increased. Again, subject always to what I keep saying and Dr. Lee keeps saying is that people need to remember that the virus is still out there. As I said before, we can project that there are at least 1,000 active cases based on the results that we get, the infection rates that we've been tracking for the last 2.5 months. So yeah, we're hopeful that the numbers would get increased and we'd be able to release some more. If this current release doesn't significantly impact the infection rate, which is, I say, running somewhere around 1.3, 1.5 now, that's manageable. We can manage that.
Okay, thank you. The next sort of housekeeping one, have you got a date set for the next meeting of the LA? And in particular, when do you think you're going to be able to reforecast, give people an idea of the reforecasted budget?
We're looking, we've only just met in caucus this morning, and I think we're looking at a date which we haven't announced yet, and Cabinet has not formalized. But I think we're looking at a date now of about somewhere around the 29th of June.
Right.
We've got a number of significant bills relating to financial services, again, relating to the EU blacklisting process that we're trying to extricate ourselves from, that need to come on quite urgently. I'm not sure where the Minister of Finance is with respect to the forecast, to the recasted budget. I don't have that answer now, but we're certainly working on that.
Okay, because obviously you're going to want to know how much money you've got to spend, because earlier on you spoke about the tourism jobs, and you said that these individuals that actually register will be entitled to claim $1,000 a month for 3 months.
Mm-hmm.
And at the moment, you've got 1,000 people registered. But yet before the lockdown and everything, yourself and the tourism minister repeatedly said that there were at least 4,200 jobs dependent just on cruise tourism.
Mm-hmm.
So that would suggest that there are even more in the, across the spectrum of the whole tourism product. And yet only 1,000 people have registered. So that's a big difference in how much money you're going to be able to give out. For example, it's going to be at least 3 million versus 12 million.
Yeah.
So, I mean, what's the situation with these figures? I mean, is it because government just predicts the 4,200 figure was just way wrong? Is it because they are actually held largely by work permit holders? Or are there any concerns that people, for whatever reason, or Caymanians, for whatever reason, are just not coming forward?
Well, I think it's a combination of all of those things. I mean, our numbers are pretty solid. I mean, we didn't just pluck them out of the air. But certainly broadly across the tourism sector, the vast majority of people employed were people on work permits. The vast majority of businesses are owned by Caymanians, but the vast majority of people employed in the tourism sector for many, many years have been people on work permits. The difference between cruise tourism and stayover tourism has been that the majority of jobs in the cruise sector have been held by Caymanians, which is a smaller percentage overall of the overall tourism sector than the stayover. But there are a number of factors at play, but we're constantly working on this and making adjustments as we go along. I mean, the other bigger issue which we are grappling with now is, are the businesses themselves, and some of them that are so reliant on or whose premise is tourism, are about to fold, and we're looking at how we can provide them with substantially more financial assistance than what we're talking about here, which are really, this money is really to individuals, not to businesses, just to keep people themselves going. But we've got to try to prop up as many of the businesses as we can on the basis that tourism is going to recover, and people are going to come back here, and we want as many businesses to be able to survive this time as possible within government's ability to do so. So we started grappling with that seriously again this morning, and we'll continue over the course of the next week. Because people are writing to us, so we're getting pretty good information about what's actually happening on the ground.
What sort of timeline are we looking at for the staycations that have been seen as a really good, like not just staycations, but like, having locals start going to attractions and things like that? What sort of timeline are you looking at that before the borders open?
Well, again, I don't have a crystal ball. I can only go on the way things have been tracking. But I would estimate that probably the end of this month, early July.
Okay.
If nothing terrible happens, if we don't get clusters popping up somewhere or an infection rate that starts to go in the wrong direction significantly.
Okay, great. Thank you. I appreciate that. Thanks. Thanks, Mr. Perry. That's all my questions, Donna. Thank you.
Okay, thank you very much. Wendy, we're going to go now to Radio Cayman's April Cummings.
Good afternoon, everyone. I just am looking for a bit of clarity with regard to, I think it was Donna mentioned that we're seeing some restaurants who maybe don't have outdoor areas currently setting up tents and that sort of thing. If their trade and business license doesn't allow outside operations, are they still okay to set up a tent and conduct business that way? I just want some clarity because we don't encourage people to violate the rules.
Yes, as long as they get the approval of the plan by curfew time. And while I'm sitting here, I've just received a note from the chairman of the Liquor Licensing Board. So all of that is being done for those who have liquor licenses, and most, not all, but many restaurants do. So this is being done in consultation with the board, and making sure that we meet the requirements. Because all we're talking about now is service outside. So all the preparation of food and all of those things would still be done inside the facility. So it's just serving people out of doors, and you're not allowing people to go into the facility itself. So, concerns about sanitation and hygiene and proper protocols with respect to preparation food, those would still be maintained. And remember now that many restaurants have been up and running, if not from the very beginning of the shutdown, certainly during the process. So it's just a matter of now beginning again to serve seated guests, albeit outside rather than inside.
Thank you. I think that helps. And this next question is for you as well, Mr. Premier. I just wanted to give our listeners an idea of what your COVID-19 day looks like now. What is your life like? Just could you run us through what a day in the Premier is like right now?
Well, I can say honestly, it's actually improved significantly over the course of the last month or so. I think one of the best things that COVID gave me back was getting back to my regular cycling routine, which quite frankly I hadn't been doing with anywhere near the regularity that had hitherto been the case for probably about 3 years. And so I am, that always makes me feel a great deal better in every respect, mentally and physically. And it's actually even knocked off a few pounds, which had crept on over the course of the last few years. So I try to do that 3 or 4 times a week now, and that's going very well. And then I turn on, as soon as I get back home and I change my cycling gear, I turn on the phone and start dealing with the many messages and issues that are there. I spend most mornings at home dealing with that, and then I come into the office around midday, and the governor summons me to his office and gives me my marching orders, and and we work on various issues. I mean, as you would gather, there's a myriad of issues. The business of government has to go on, and in fact, it's more difficult in many cases because people are not around you, you can't just walk into someone's office and say, what's happening, how we do this. So we get used to this idea, which I hate, of Zooming or phone calling to be able to get things done. And then towards the end of the afternoon, my @PM group, which is made up of the Cabinet Secretary, the Minister for Border Control, the Chief Officer for Minister for Border Control, Wesley Howell, and Eric Bush, and Roy Tatum. We get together and either personally or over Zoom, and we talk through about the broad swath of issues that are existing, and things that are urgent, and I finish up here usually around 8:30, 9 o'clock in the evening, and then I repair to my home and watch TV until it watches me.
Sounds like a pretty hefty day to me.
It's a full schedule. Just one other question. This one actually is for the governor. I had some folks asking if there was any update on repatriation flights to Nicaragua.
We are very aware that there are still large numbers of Nicaraguan nationals who want to return, but we were told that there was no permission from the Nicaraguan government, but we should come back to them in a couple of weeks. So, I mean, we are planning to return to that, and we hope very much to be able to arrange that as soon as possible. But again, as of today, there is no agreement.
Thank you very much, sir. And then I think it was a couple of years ago, the Kids Helpline, it just sounded familiar what Minister Seymour was talking about. Is this the same as the one set up for the Crisis Center that was a pilot program a couple of years back?
Not quite sure.
The kids mental health line.
Not quite sure about that, April.
Okay, thank you very much. I appreciate it. Those are all my questions.
Thank you.
It is.
It is. Okay. Dr. Lee is actually saying, April, that it is.
Thank you so much.
Okay, I do have a final question, and then we're going to wrap up. Some persons just want to clarify that since restaurants can only operate until no later than 9 p.m. for outdoor services, does this mean that their customers must leave the premises by 9?
Well, the point is that the curfew will begin at 10. Hence why we've sort of insisted that they stop serving at 9 to give people a reasonable time to say their goodbyes and get home by 10.
Okay. I'm sure that answers the question. Before we go, just a reminder about
And may I just say, because I've got some questions coming in, I did say this, but some people may have missed it. Going to restaurants and bars is not subject to the alphabetical division of days. You can go any day, as long as you can get reservations, because I would urge people, except for the restaurants in particular, that you need reservations because you can't just walk in, and there's going to be much more limited space because of the social distancing requirements. And I'm quite not sure how the bars are going to work, but you're going to have to find a table that someone will allow you to sit at. So
Interesting. Okay, any final words from the panel?
I just wanted to clarify earlier when I was asked the question about medical training and so forth, that there's also that at the HCCI, El City, and at the HSA for some time now trained nurses, and there's also a program that sponsors persons to go abroad, and also both at undergraduate level and specialist level. So I just wanted to note that also.
Thank you very much, Minister. Just a note, earlier His Excellency mentioned a recruitment drive for 50 persons to the Cayman Islands Regiment. If you want to know more about that and the criteria that's needed to apply, you can go online to gov.ky/CI Regiment for more details there. Of course, we thank you, the public, for joining us. We thank our panelists for being here today and bringing us up to date. A reminder, of course, again, to go online to gov.ky/coronavirus for any answers to questions that you may have. It is Friday, so we'd like to encourage you to watch the Child Month Teen Panel, which looks at the impact of COVID-19 on local teens. It re-airs right here on CIG television tomorrow, Saturday, the 6th of June at 6 p.m. Of course, we invite you to join us again next week, Tuesday. Until then, be safe. And for those of you watching, please take a look at today's regional and world coronavirus statistics.